Everyone, today I will talk about the peripheral neuropathy. What is neuropathy? Symptoms of neuropathy. What causes neuropathy? What are the most common treatment for neuropathy? Why many common standard treatment doesn't work on neuropathy? Peripheral neuropathy is a medical term for nerve damage. Most of neuropathy are mostly in the feet or hand. Majority of cases, feet are always affected first because nerves are the furthest away from the spinal cord and the nerves are the longest. Symptoms of neuropathy are completely different for every individual. It can be numbness or burning or tingling or pins and needle or some kind of weird sensation, feeling. These symptoms get worse over a period of time, over months to years, and are different for every person over time. As the nerves get worse, the nerves of the feet can also become involved, leading to a problem with not being able to stand properly or loss of balance, coordination, or possibly fall. What causes neuropathy? The most common is chronic diabetes, even if it's well managed, chemotherapy, side effects from certain medications, chronic inflammation of the nerve, unexplained causes, and poor circulation from chronic diabetes or poor circulation from chronic smoking. All of these factors can damage the delicate blood vessels that are responsible for feeding your nerves and keeping them healthy. Most of the people seeking treatment which often begin with and end with a symptom cover-up approach. Medications like gabapentin, Lyrica, Neurontin, even if they work at all, they cover up pain but do not stop or reverse the nerve damage. Antidepressants like Cymbalta may help one to tolerate the symptoms, but again, do not address the underlying causes of the nerve damage. If the medication do not work, what about surgery or physical therapy? Unfortunately, there isn't a surgery to fix the progressive nerve damage itself. Surgery can definitely help if there is a nerve compression or nerve entrapment or nerve tumor. Physical therapy doesn't work either. The exercise or physical therapy can definitely help with stretching or strengthening or balance, but it cannot stop or reverse the nerve damage because the nerves are the internal problem. We offer a deep tissue laser therapy with the goal of providing your damaged nerve with the blood, oxygen, and nutrients which they need to improve throughout the entire healing process. It's like adding a sunlight, water, and miracle-grow garden soil to a plant and seeing the roots grow deeper and deeper. Thank you.